medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
The question I think that many of us as clinicians ask, and it's a valid question, does testosterone replacement therapy in men increase the risk of prostate cancer and any other adverse prostate events? Well, we're going to get this answer today because I noticed an article that came out in December of 2023. They took 5,204 men, and that's a nice sample size, age 45 to 80 years, with hypogonadism in a randomized clinical trial. The study's findings were to appraise the potential prostate risks of testosterone replacement therapy. There was a placebo-controlled, double-blinded, randomized clinical trial from 3 United States trial sites and 2 testosterone tests that showed that person or that man had less than 300 nanograms per deciliter. And this is called the transverse study. Men with prostate-specific concentrations, PSAs, greater than 3 were excluded from this particular study. Now, the participants were referred for urological evaluation or biopsy if they had anything, including the following: a confirmed PSA that increased once they started the study, more than 1.4 nanograms per ml above the baseline in the first year of treatment, confirmed PSA concentration greater than 4 nanograms per ml at a time, and for men aged 45 to 54 with a baseline PSA concentration of less than 1.5 nanograms per ml, a PSA level that increased to 3 nanograms per ml at any time. And the fourth reason there was the referral was a prostate nodule or induration at any time that they felt. The primary prostate safety endpoint, or the endpoint of this study, was an incidence of course, a high-grade cancer. That's a Gleason score of 4+3 or higher. There were some secondary endpoints included in the incidence of prostate cancer, acute urinary retention, in some invasive prostate surgery that was done for BPH, a biopsy, and any new pharmacological intervention for Lutz lower urinary tract symptoms. So what happened? And this is of the greater of the 5,000 men, 5 got a high-grade prostate cancer. And actually 3 in the control group did as well. Now at this point you should be going, whoa, this sounds really good. It is. The number of the participants with any prostate cancer did not differ pretty much between those that got the testosterone and or the placebo groups. There was no significant difference between the groups in PSA levels after 12 months at all. And so here is my opinion and the takeaway on the study and how you should really be looking at it. This is a large study that pretty much shows the safety of testosterone therapy in men with no cancer to begin with. Now, they could have used a free PSA as a marker as well and other markers and different blood values, but that's okay. There are still questions of safe prostate cancer potential use and using it in patients with. But that's already been examined using testosterones by others, like Abraham Morgenthaler has discussed it. Now, a large trial would make sense. Well, we'll see if that has anything to do with it or there's any problems. Eventually, prostate cancer has to be challenged in this area. So the challenge is, does testosterone really cause any issue? And would the study have been even more favorable, along with the fact that it's already good for clinicians that use a natural product to safely distribute and excrete any of the metabolites of testosterone? I think so. And I think this is a marked beginning for us, and especially those clinicians that prescribe testosterone, knowing that pretty much it's like I always said, look at teenagers in high school. When you were in high school, how many people could you point to? How many men had prostate cancer? For the most part, that answer will be 0. And of course, you'd have to wonder, the highest testosterone, the lower the cancer. And there are studies that support that as well. For more information, please contact me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.